When I go to college, I want to study to be an orthopedic surgeon. That career has always interested me. I know people that are going to college to be an orthopedic surgeon, as well as some people that are already orthopedic surgeons. Those people inspire me the most with their determined and intellectual as well as social abilities. I feel as if their social abilities are just as crucial in their profession as their intellectual abilities because they need to be able to communicate very effectively on both or to both the staff and the patients. I believe that communication studies matters and makes a difference in the daily life of the orthopedic surgeon. It is prominent that these surgeons are able to communicate verbally, non-verbally, and electronically. Orthopedic surgeons have to talk a lot throughout their workday. Whether they're just talking to their staff during their downtime or it's during surgery, their precise verbal communication skills are very critical. Surgery is very complex and it requires everyone involved to know what the term, item, and word means. If a surgeon doesn't have a very good verbal communication, they can mess up quite a bit. They could do anything from messing up a scheduled appointment time to using the wrong utensils during surgery or anything else. It is very hard to be well acquainted with every medical term, so that is why orthopedic surgeons have to focus on their knowledge of terms and their ability to regurgitate those terms fluently during their workday. Nonverbal communication is also very common during the average day of an orthopedic surgeon. People come into their offices to get checked up when they're in pain to see what's wrong with them. When examining their patients, the surgeons feel the areas that hurt and apply pressure to them. If they notice that the patient is showing signs of pain, they let up. That's an example of nonverbal communication that they use. If the surgeon didn't know how to read the patient's cues of pain, they could hurt the patient and potentially worsen the issue. Causing pain to a patient that goes to that very doctor to get help for what feels bad is a very bad situation that every doctor knows to avoid. Patients trust the people in the medical field, and it is very important to keep their trust by knowing their boundaries through nonverbal cues. Orthopedic surgeons also need to know how to communicate electronically, especially in this day and age. When going to any hospital or medical building, there are tons of electronics everywhere. This is because medical technology has evolved so much, and everything that has anything to do with a hospital has a computer program to go along with it. Knowing how to understand and interpret everything that's on these computers and machines is very crucial. If a surgeon reads something wrong, they could mess up any one of their procedures and accidentally tamper with a patient's files. Communication is a very critical aspect of any career. Even if I decided that I didn't want to be an orthopedic surgeon, I know that studying communication would still be just as important for any path that I may choose to go down. It is impossible to operate effectively and be successful in a workplace without having good communication skills. That's why I believe that communication matters and makes the difference in the daily life of an orthopedic surgeon.